Hello guys, welcome back to my channel. So today we're going to talk about how to prepare for your very first exam in nursing school. I'm kind of glad we get to talk about this today, because anybody who's been through nursing program can tell you that preparing for the very first nursing exam is very nerve-wracking. You're going to be scared, worried, nervous. You don't know what to expect, especially because this is your very first one. You don't know exactly what to expect from the teacher. You don't know how they're gonna test you, so it's understanding for you to be scared. But before we go into it, if you have not subscribed to my channel and you are watching my video, Biko, help now, help my channel now. Subscribe, comment, like, engage, help our channel grow. Thank you very much. As you do so, click that button, click it. I think it's on the right side. Click it. Help me. Okay, so let's just go right into it. So, preparing for your very first exam in nursing school. In 2009, when I went to nursing school, I failed my very first exam. I failed my very first exam because I don't know some of the things I'm sharing with you guys now. That's why I failed my very first exam. So today we're going to talk about it. The very first thing you need to pay attention to is your nerves. Trust me, anxiety is a good thing, but it can also be a very bad thing. And you are going to have anxiety. There's no way around it. This is your very first exam. You've never done this before. You don't know what to expect from the teacher. You're going to have anxiety. But you have to learn how to control it. It's hard. I have been there, especially when I was preparing for my NCLEX. It is hard. But you have to learn to control it. Because first of all, this is your very first exam. The worst come to worst, you don't pass it. Then what happens? You learn something from it. You get to know your teacher better. You get to learn how he tests better. So you can always learn from it when you don't pass it. So, but we want to pass it. That's the major reason why I'm doing this video. We want to pass that very first exam. So calm down, relax, get your nerves under control. Get your nerve under control, because when your nerves, when all your adrenaline, everything start going up, it messes with your psychic. So you want to be relaxed. You cannot understand something when you are all worked up. You cannot retain information when you are worked up. So you really need to calm down. So that's the very first thing you need to do before you start preparing for your very first exam in nursing school. The second thing is you need to know your learning style. Everybody does not understand information by reading. Everybody does not understand information by looking at it. Everybody does not understand information by just drawing. So are you a visual learner? Are you an audible learner? Are you a kinetics learner? Do you like to draw, paint the picture? What kind of learning style are you? It is very important that you know this before you even start your nursing program, so you know how to navigate through preparing for your studies. Because it's one thing to study, it's another thing to study effectively. What I mean by effectively is study and see the results. There is a lot of people that study in nursing school and they don't see the results. And there are some people that study and they actually see the results. You have to understand your learning style. For instance, if you are a visual learner, you don't want to go sit in the back of the class. You want to sit in front of the class, that you can see everything the instructor is writing, everything is illustrating, you can see it. Because you're a visual learner, you learn better that way. So you want to come to class early, you want to be there on time so you can sit in the front. If you're a audible learner, you want to sit close to where you can hear your instructor speak. You don't want to be far away from him. You want to be able to hear him. You can even record him if he's allowed. Some classes, they allow it. Some classes, they don't allow it. But if it's allowed, you can record him. And if you are a kinetics, you want to sit in the class close to the teacher and you can kind of illustrate what he's saying. So you want to know your learning style. That will help you prepare. That will help you with how to study effectively. Because the major thing, the reason why people are failing their first exam, the reason why I failed my first exam was not because I did not study. I studied, but I didn't study effectively. I didn't study the way it will work for me. So I needed to know myself first. Know what works for me before I study. So you need to know. So I've talked about two things. You need to relax. You need to know your learning style. The third thing is you need to prepare from the very first day of class. Don't prepare for your first nursing exam last minute. That is not a good idea. Anybody that has been through the nursing program will tell you that is not a good idea. Because your very first exam, you don't even know where this teacher is coming from. You don't know anything about the teacher and his testing strategies yet. So you want to prepare the very first day you enter that class. Have your notes with you. Have your highlighter with you. Print out your PowerPoint before class starts. Usually what nursing instructor do is they go through your textbook for each chapters they want to talk about, and they make a PowerPoint and they talk in details about the PowerPoint. So you want to have your PowerPoint ready. When you get in class, you want to be able to flick through the PowerPoint as the instructor is doing the same thing. So you want to prepare the very first day of class. You do not want to do this last minute. Take notes. You want to highlight what he's saying. Now listen to this. When your instructor is repeating something more than once, if he's saying it once, twice, 3 times, and it's the same thing, you want to write it down. More than likely, that is going to be on your test. When they start repeating something, and they're talking about signs and symptoms of heart failure, and they keep talking about signs and symptoms, and they keep repeating it, write it down. Write that down because it's going to be on your test. They do that. So, the fourth thing you need to know, is he going to give you a study guide or not? Is he going to give you a study guide? If he gives you a study guide, you need to go through each study guide. It's not all instructor in nursing program that gives study guide. I'm saying this for an instructor that gives study guide. Go through each study guide question. I know in Message 3 they gave us a study guide, and I went through each question and I answered the question and I highlight it and I reread it to myself. What works for me is I have to highlight, I have to see something bright. So I'm kind of like a visual learner. So I will highlight it, reread it to myself, make it bright. And I kept doing that, and I answer all the questions on the study guide. But listen, if he gives you a study guide, don't think that everything that is going to be on the test is going to come from the study guide. They can also test you outside of the study guide. So what you want to pay attention to is, if he says your test is going to be on chapter 1, 2, 3, and 4, and 5. After you do your study guide, you want to make sure you go back into your chapters in the book. Highlight the main point. Read it. Pay attention to stuff in the boxes. Pay attention that is colored differently. Go back into your textbook, because let me tell you what happened to us. In Message 3, Message 2, we had a study guide, but it tested us. It didn't only test us, it's a female. She did not only test us on what was on the study guide. She tested us on other things on the chapter. And everybody was like, oh, that's not on the study guide. That's not on the study guide. She said, well, it's not on the study guide, but it's on the chapters I told you we're going to have a test on. So even if it's not on the study guide, make sure you go back to your chapters after you have done your study guide, because they don't have to test you only on what's on the study guide. They can choose to test you on stuff that is not on your study guide. That's why it's important that you still read the chapter. And pay attention to the bold point. Pay attention to the highlighted stuff in your book. Pay attention to stuff in the boxes. If you have one of those nursing textbooks, you'll see some stuff in boxes. There are some stuff they put in a different corner in the textbook. Pay attention to those. Those things are usually what they test on. As you are reading, take note of the main point. So that's another thing I want you to know. Another thing that I didn't know that is very helpful in the nursing program is this. More than likely, if you are a nursing student, you are going to be starting off with fundamentals. Every nursing program start off with fundamentals, and then you work your way into your med-surg, to your psych, to your OB, to your pediatrics, but you start with fundamentals of nursing. So the way fundamental work is that you will have a skills to do. You have a skill checkup to do, and you will also have tests on your theory. So example, your skill checkup might be how to take a blood pressure, how to check a temperature, how to insert an NG tube, how to give feeding through a feeding tube, how to change a wound dressing. Those are your skills. The way it works is you will practice it on a mannequin, and they will have a mannequin for you, and you will practice it on a mannequin. Okay, so they are testing you on two different things in the beginning of your program. They are testing you on theory in fundamentals, and they are testing you on your skills. So the teacher will sit down, they will watch you do the skills, and they will watch how you do it step by step. So in fundamentals, you're learning two different things. You're learning your skills, you're learning your theory. So this is what I think works. Get you a flashcard, or I got one of those green I got one of those what do they call this, like a board, but I got like a colored one, or you can get a cardboard, and I wrote those skills down one by one, and I left spaces in between it. Like if we are checking off tomorrow on how to take a temperature, I will be home and I will be rereading it to myself. And because I'm visual too, I will make sure I get a colored cardboard, and I will be rereading it to myself. And that works. Some people get a flashcard and write each step one by one, how to take a temperature, provide privacy, tell the patient your name. You go one by one. And that's how to study for your skills. You just have to make sure that you can repeat the step. I even practice at home. I practice on a dummy at home. I would just, especially when I was doing my LPN, because I was new to nursing, I was practicing with everything. I practice with a dummy at home. I would just go, my name is Barbara, I'm gonna be your nurse today. I will provide privacy. I would check my patient identification band. You practice at home with a dummy. Practice on your husband. Practice on your spouses. If that works for you, do that. I'm talking about for your skills, because when you're doing it in school, the instructor is going to be right there watching you, and she's going to make sure you don't miss any step. Remember, nursing is about people's life, so they are not going to pass you if you are not doing the right thing, because they don't want to send a nurse out there that's going to kill somebody. So it's important that you know your stuff. So that's how to prepare for your skill checkoff. Take a note, write it down, get a flashcard, write it on each flashcard step by step. And for your theory, do your study guide, go over your chapters, highlight, write the points out. Now, when you are studying, you do not want to memorize your studying. You want to study to understand. The problem with nursing is that if you memorize your study guide and for some reason you are able to get through nursing school, when you get to NCLEX, there's going to be a problem. Because if you don't know what NCLEX is a National Nursing Board Licensure Exam. NCLEX tests you on knowledge, on how you can apply the nursing knowledge. They don't test you on memorization. So if you memorize through nursing school, when you get to NCLEX, you might find it very difficult to get your license, because they're going to test you on how to apply those knowledge. They'll give you a whole bunch of scenario. We'll talk about NCLEX next time. NCLEX is not for today. But what I want to say is, make sure what you are reading, you are understanding it. Understand it. Don't just study to memorize. It will help you at the long run. And some teachers in the nursing program, some of them, they don't even, they test you on applying it. They start testing you on application early in the program. So you want to understand what you're reading. You don't want to memorize. You don't want to memorize at all. You do not want to go that route. So understand your stuff. Another thing, the very last thing I want to tell you, For somebody that is just starting nursing program, some program they use ATI program. Some people use SC. Some people use Board Vitals. So schools use different program, and each program they give you textbooks on each stages that you are in the program. So if you are in fundamentals, they'll give you some textbook on fundamentals. If you're in pediatrics, they'll give you those books in the beginning of the program. At least the school I went to, they gave it to us in the beginning of the program. So as you are preparing for your very first exam, let's say you have exam on 4 chapters in fundamentals. You want to go back to those textbook that they gave to you that is outside of your nursing program textbook, like the ATI textbook, and do questions on those topics that you're going to get tested on. So let's say you have a test on 4 chapters. The teacher told you, okay, next week we're going to prepare for our very first exam. It's going to be on 4 chapters. Chapter 1, chapter 2, chapter 3. So you go on those chapters, see what the topics are. Put those topics on YouTube. That's what I did in Message 3. I struggled when I went back for my RN. I struggled with Message 3 a lot. And I ended up passing that class with A. I did it not because of what I learned in school alone. I went on YouTube. I did questions outside of the nursing program. So on each chapters you're going to test on. They have it starting from fundamentals. On each chapter you're going to get tested on. Go on YouTube. Go on YouTube. Find topics that relate to that chapter and do questions on them. Sometimes the people on YouTube, they are able to explain it better than your instructor. You might grab, like, one of the area that I struggle with the most was ABGs, like and I was able to understand it through YouTube. I watch YouTube video. So watch YouTube video. You can start as early as fundamentals. You can start doing those practice questions. That will help. You might see, don't be surprised, some of those practice questions you do, you might see them on your very first exam. So what am I trying? Let me just wrap up what I'm trying to say. The very last point I'm trying to say, if you have tests on 4 chapters, this is your very first exam, and it's on fundamentals, write out the chapters, write the name of each topics on the chapter house, go on YouTube, look up videos on it, watch the videos, do questions on it. Grab the ATI book they gave you in school, do questions on it. If they gave you Board Vitals, do questions on it. Just do questions on them. So at the end of the day, you will pass because you have done multiple teams. You have taken notes, you have highlighted, you have reread it to yourself, you have done practice questions on them, you have listened to another person that is not your instructor explain it into more details for you. And that right there will prepare you for your very first exam. So a lot of people, the reason why we fail the first exam is because we don't have this information. We just start nursing school like we start. But I'm telling you that to prepare you for your very first exam, 1, calm your nerves down. 2, you want to make sure you know your learning style because that will help you on how to study. 3, study to understand. Don't study to memorize. Take notes in class. When your teacher is saying something multiple times, more than likely that's going to be on the test. Go outside of your nursing program. Go on YouTube. Listen to videos about the topic you're going to get tested on. For your skill, you want to write it down on a flashcard or a bill or a board or something that you can understand. Because 2 things happen when you don't pass your first exam. You either learn from it, you understand your teacher better, you understand how we test better, and you do better next time, which is the good thing. Or you get discouraged from the nursing program. You fail your very first exam and you're like, oh Lord, nursing is not for me. Hey, mommy, I can't do this. I don't think nursing is for me. I failed my very first exam. It is not for me. Oh, hey, I don't think I will make it in this program. That can happen when you fail your very first exam. So when I failed my very first exam back when I was doing the LPN, not the RN. When I did the RN, I already know this information, so I passed everything. But the LPN, when I failed my very first exam, I didn't get discouraged. You know how, I was like, oh no, this is a do or die. I'm gonna do this. And I just paid attention to how my teacher tested. I pay attention to his testing style. I pay attention to what he's saying multiple times in class. I highlighted, I took notes, and that helps. So basically, I'm hoping that this video will help somebody. More than likely, if you're watching this video, you're probably starting nursing program. You're preparing for your very first exam in nursing school. And I hope some of the tips that I put out in this video, I hope they help you. Thank you so much. We will see you in the next vlog. Don't forget to subscribe, like, comment, share. Let me know what you think about this video. Do you think that will help you? Do you think something I said is not right? Let me know. Thank you so much and have a nice day. Goodbye.